joining us for this week's Community Leader Call. My name is Tomas Talmonte, Deputy Chief of Staff to Mayor Muriel Bowser. We want to thank you for joining us this week and every week as we answer your questions related to the district's response and recovery efforts for COVID-19. Before we get started, I want to remind everyone again for the most up-to-date information and resources related to the district's response on COVID-19, you can visit coronavirus.dc.gov. Also, if you have any questions for our speakers today, you can press 0 now to enter the question queue, and we will begin a Q&A portion here shortly. But want to remind everyone at any moment if you have a question during our call, you can press 0 to be entered into the question queue. You can also, if you're watching us streaming online, as well as or on the mayor's social media platforms, you can ask your questions there as well. And we will take some questions from the online platforms as well, social media platforms. So again, if you have a question, you can press 0 now. Also want to remind everyone to complete your census. If you haven't done so already, you can complete your census at 2020census.gov. So again, I want to remind everyone to please complete your census if you haven't already. We want to make sure that everyone is counted in the district. So again, 2020census.gov to complete your census. Today we'll be joined by the DC Department of Health Director, Dr. LaQuandra Nesbitt, the Director for the DC Homeland Security and Emergency Management Agency, Dr. Christopher Rodriguez, and the Director of the Mayor's Office of Nightlife and Culture, Director Sean Townsend. We will hear first from Director Sean Townsend on an update on streeteries and our new Winter Ready grant program with the streeteries. So, Director Townsend.
Good afternoon, everyone, and thank you, Tomas, for having me here today. Feel like I'm on an announcement tour of the new grant program that we've announced. But today, actually Monday, was the opening day of the applications, where we began accepting applicants who were interested in applying for the Streetery Winter Ready grant program, and that allows for us to issue grants in the amount of $6,000 to businesses to help defray the cost of their outdoor dining spaces. So that would include costs for heaters, propane, tents, furniture, lighting, any type of hard costs associated with your outdoor dining spaces. In addition, that allows for you to spend a third of the grant funding for marketing or advertising for the business as well. So there are a few stipulations to the requirements of the grant. You must have at least you must qualify for one of the following criterias. Either you are 50% owner and you reside in a district, your business has 50% employees, or 50% of your gross receipts are here in the District of Columbia. There are some other qualifications as well: clean hands, basic business license, etc. And you also must have an approved outdoor space from the district. So whether that's ABRA or DCRA or DDOT, you must have an approved outdoor space. We're currently taking applications through. It's on a rolling basis, so as funds are available, funds will be dispersed. We will begin dispersing funds hopefully by October 1st, and we have about $4 million to submit to actually disperse funding to interested applicants. So I'm here to answer any questions at this time, and also feel free to submit any questions to nightlife@dc.gov. Thank you, Tomas.
Thank you, Director. So we'll now move into the Q&A portion of today's call. Want to remind everyone again, if you have any questions, you can press 0 now to be entered into our question queue, or you can ask your questions on the Mayor's social media platforms on Twitter as well as Facebook at Mayor Bowser on Twitter and the Mayor Bowser's Facebook page. The first question is coming from online. This question is for Dr. Nesbitt. And the residents just wants to know more about the new partnership with DC Health and flu shots at the testing location. If you can give more information on that.
I'm sorry. They want to know what exactly?
They wanted to just get more information about they had heard there's flu shots available at some the testing locations in a partnership with Walgreens. I wanted to hear more about that partnership?
Sure. So we know that it is extremely important for us to emphasize, like we do every year, the need for individuals who are 6 months and older, 6 months of age and older to get influenza shots. And so as part of our efforts to expand access to health care, we have partnered with pharmacies in the District of Columbia, beginning with Walgreens, to expand access. And this week on Monday, we began to offer flu vaccines in partnership with Walgreens, co-located with our COVID-19 testing site on F Street at Judiciary Square from 8 a.m. to noon. But more information related to flu shots can be found on coronavirus.dc.gov or by going to the dchealth.dc.gov website.
Thank you, Dr. Nesbitt. We're going to go to our next question from Robin Blunt in Ward 5. Robin, your line is unmuted.
Hi, this is Robin Bunch in Ward 5. Thank you for taking my question. I was wondering when Phase 3 will start and what does that entail? Thank you.
Sure. So we do not have a specific timeline for entering Phase 3. We encourage all residents to follow along with our progress. We are currently in Phase 2 on coronavirus.dc.gov. You can find all of our metrics at coronavirus.dc.gov under the Data tab. We'd also like to remind residents that there are other activities that could be started in Phase 2 that have not yet been initiated, such as in-person school and some other activities potentially at our parks and recreational facilities and some entertainment options that may be approved through waiver.
Thank you, Dr. Nesbitt. We'll go to our next question. Before we do that, just want to remind everyone one more time, if you have a question, you can press 0 now to be entered into the question queue, or you can ask online on the social media platforms. We're going to go to Larry Kaufer in Ward 6. Larry, your line is unmuted.
Yes, I noticed the information on Washington Post about some additional activities, or should I say lessened restrictions under Phase 2, and wanted to know some detail as to what they might be and when. And as part of that, I'm a senior citizen and an adult swimmer at Natatorium for 40 years, and that was mentioned. I would like to know when that might start. Thanks.
This is Chris Rodriguez from DC Homeland Security. Thank you for the question. To follow up on what Dr. Nesbitt was mentioning, there are some activities in Phase 2 that we are looking at, actively looking at reopening. And as a fellow swimmer, I too am looking forward to reopening indoor pools. That is an activity that is currently under consideration, and looking at how we can do that in the safest and most and healthiest way possible, consistent with CDC and DC health guidelines. The other thing that we're looking at, as Dr. Nesbitt mentioned, is in-person school in Phase 2. That is an activity that we are planning for and actively soliciting the guidance from DC Health and looking also at national trends. Another activity that we could begin to start in Phase 2 is looking at live entertainment. And the mayor has spoken about this publicly, and we hope to have more to say about that in the coming weeks.
Thank you, Dr. Rodriguez. We're going to go to our next question from Jacqueline Mintz. Jacqueline, your line is unmuted.
Thank you. This is for Dr. Nesbitt, and my question is the older population and access to more outdoor exercise, and whether the district might consider something like Tai Chi in parks in each ward. Because any indoor thing is out of the question, particularly for this population, and muscle mass loss is a big issue.
So thank you so much for your question. There have been a number of fitness service providers who have been offering outdoor fitness opportunities since we began in Phase 2 back in June. There would be of course, different guidances that we have provided to parks and open spaces service providers that they have been following for no and low contact activities that have been permissible. So we would encourage anyone who is offering services to provide those services according to those guidelines.
Thank you, Dr. Nesbitt. We're going to go next to Christina Moody in Ward 7. Christina, your line is unmuted.
Hi, I have a question regarding coronavirus testing for children. As I understand, there's age limits and generally no testing available for children. And as we open up schools in the district, I wanted to know if the district plans to make those services available or expand them to control the virus if it comes out in children. Thank you.
Sure. Thank you for the question. We encourage everyone who is interested in having a test or who needs a test to contact their healthcare provider. There is no restrictions or age limits for healthcare providers to provide coronavirus testing to their patients. And all healthcare providers within the scope of their practice can test a patient for COVID-19. The district's public testing sites serves anyone aged 3 years of age and older.
Thank you, Dr. Nesbitt. Our next question is from an online question for Director Townsend. The question is just if you could just remind people where they can apply for the Street Winter Ready grants and the timeline of that program.
Sure. So the application is currently housed at coronavirus.dc.gov on the recovery page under business, and it's located right at the top of the page.
Great. Thank you, Director. We're going to go next to Will Stern in Ward 3. Will, your line is unmuted.
Hi, thanks for taking my time. I'm a parent of two elementary school-age children in Ward 3, and they are in the D.C. public school system, which we love. I will say, however, online learning has been a real challenge for my kindergartner and my fourth grader. Like everyone else, they're fatigued with it. My wife and I both work, so it's just an incredible stress and demand on our household. My question simply is, did D.C. public schools look at taking classes outside, whether it be at the school grounds for where kids are in boundary for, or just using other D.C. Lands, of which the city has many that could have been used and afforded for outdoor schooling? I hope that's something that's being considered, so I look forward to hearing the response. Thank you again.
Thank you, sir. This is Chris Rodriguez from D.C. Homeland Security. I am also a parent of school-age children in Ward 3, so I do sympathize with some of the concerns that you're raising. And as the mayor has laid out, one of our goals in Phase 2 is to look at how we would be able to implement the in-person learning or the hybrid options that were discussed over the summer, which we ultimately had to make an all-virtual decision based on the public health environment. And so those considerations that you raised are being considered by the DCPS team and along with DC Health as we try to reach that goal of getting kids back in school by November 9th. So the mayor has directed her agencies to make sure that if we were to go and to open up a hybrid learning environment, that those buildings and facilities would be ready to receive children and teachers.
Thank you, Dr. Rodriguez. Our next question is going to be from, before we go to our next question, just want to remind, we're getting close to the end of the call, so just want to remind everyone to press 0 if you have a question, if you haven't been able to ask your question, or you can ask us on the live stream, social media, Facebook or Twitter. But our next question, we're going to go to John Bennison. John, your line is unmuted.
Hi, thank you for taking my question. And my question is similar to the previous callers. I noticed on the news last night that 2 local school districts are actually looking to move into hybrid learning earlier than they had originally anticipated. I guess a concern I have is DC seems, the infection rate, it doesn't seem like it's a public health issue as much as it's a teacher union holding things up. the infection rate is low enough where we could be in hybrid learning now. So I'm wondering if DC is really going to explore it. It seems it would be more important to get children back in the classroom than opening up or making sure restaurants are open or tanning salons or that sort of thing. And I can say, as having a first grader, online learning, just it's 5 hours in front of a computer. It just doesn't work for kids that young. So even if the district would consider looking at, kindergarten through second grade, like some local school districts are starting to do, I really think we're hurting our kids. The union specifically in the positions they've taken, they're hurting young kids by keeping them out of in-person learning. So I hope Dr. Nesbitt can respond and explain how it's a public health issue, because that's how it seems to be being presented, but nothing about what was originally said and what we know about our infection rates in the city now shows that we couldn't be doing hybrid learning. And lastly, November's the beginning of flu season. We're going to start hybrid learning when kids are going to be indoors more. We missed the prime opportunity by not doing it in the warmer weather. So, sorry, I know it's a lot of information, but I hope you all can provide some sort of a response.
This is Chris Rodriguez again, and if Dr. Nesbitt has anything to add to my comments, I'll certainly try to answer your questions about public health. And I think we have to be mindful that we still have significant community spread in the district of this virus, and on average we're seeing roughly 45 new cases per day. That's been our 7-day average over the last week. And so we do have to be mindful about that level of community spread. And certainly while we're not seeing the cases that we saw over the summer, and understand that people are anxious to get back to normal, including getting our children back in school, we also have to do so in a way that is, from a public health perspective, safe and effective. And so I think I appreciate your comment at the end about flu season, and it goes back to what Dr. Nesbitt said at the beginning of this call, which is getting vaccinated for the flu is absolutely critical, and it's why we are offering those vaccines at our F Street location for our mass testing site. And I would remind our callers and residents that from 8 to 12, Monday through Friday, you can get a flu vaccine at that site. So thank you.
Okay. Dr. Nesbitt, if you have anything else to add to that?
No, thank you.
All right. So that's it for the questions in our question queue. So I just want to remind everyone, if you have a question, you can press 0 now. Give it one more minute. Want to remind everyone while we wait to see if we get any additional questions to come in, that you can go to coronavirus.dc.gov for all the most up-to-date information, and you can download guidances for phase 2, as well as different resources for your business for posting signage. So please make sure that you visit coronavirus.dc.gov if you haven't already. The next question we have. No, actually, we lost that question. So that's gonna actually the question we have is one from online. If Dr. Nesbitt can explain the rollout of the metrics from Monday, the metrics change, and the way that data is being presented on the website.
Sure. So in public health, you want to make sure that the data that you're presenting to the public, that's a reflection of the complex data that public health agencies and public health experts use for decision making, is serving its purpose. Data should be able to meet a goal of surveillance, which is how we look at how the disease is impacting our communities, where the disease burden is, what populations are being impacted, and 2, how the data is helping us to manage the pandemic. As a result of that, we decided that it was necessary at this point in our response to change some of the categories that we were using for our metrics. It had become very clear that many members of our community were focusing on a single metric to understand community spread. And we needed to elevate the conversation to have people understand that there are a series or combination of metrics that public health uses to have a better picture of community spread. As a result, you will see that there are 4 metrics in a category for community spread. Number 2, we decided that it had become a bit confusing where people were looking at a metric called test positivity and interpreting that as how we measured the capacity in our city for testing. So we retired that test capacity category and created a more robust category that reflects our health system capacity more broadly and its ability to respond to COVID-19. And there are 3 metrics in that category that more broadly look at our ability to provide health care without a compromise to patient safety and quality, as well as the robust, or 4 metrics in that category, as well as the robust testing capacity that we have here in the District of Columbia. The 3rd category you'll see is public health system capacity. Currently, the 2 metrics in this category reflect the robust contact tracing infrastructure that we have in our city. So how quickly we can get in touch with people who have been newly diagnosed with COVID-19, as well as their contacts, and if we're meeting that goal for timeliness of reaching out to people. The 4th category of community engagement was an opportunity for us to put metrics out there that would help the public understand how we need the public to be engaged in the response. We can build all of the infrastructure in the public health system and our health system. We can put data out there to help people understand what the picture of COVID-19 looks like. But if people are not answering the call when contact tracers call them, if they're not completing interviews to help us help people quarantine and isolate, or providing lists of their close contacts, which also helps us have people quarantine and isolate, we won't be as effective as we can be in a community with slowing the spread, quarantine and isolating people, and doing what we call boxing it in terms of reducing the transmission of COVID-19 in our community. All of those things have been put out there in a very, what we believe is a very good color-coded way that help people see that when all of the metrics light up in one particular color, that's an indication that we should either move to a next phase that people, I think, associate with having more social activity in our community. We want people to understand that we have to have a sustained level of decrease before we can take any action, because an increase or a decrease may be long-term or it may be short-term. You'll be able to see trend lines on the website to help you see where in a period of time in early July, we had started to see substantial decreases in our cases, but that was not sustained. By the middle of August, we started to see increases in our cases that could have been very concerning, and we may have been experiencing rates similar to the Sun Belt, but because of the way that district residents responded, we did not have those same increases as the states of Texas and California. And so we need people to be able to follow along with those types of metrics. So that's what we have. We hope to put out more community engagement metrics to help people understand what it is that residents can do to continue to help to slow the spread here in the District of Columbia.
Thank you, Dr. Nesbitt. So that's all the time we have for this week's call. We want to thank all of our directors for being here with us today. We want to thank you all for joining us by phone or watching at home. Again, we'll be here next Wednesday at 5 o'clock for our next call. And want to just make one more plug for the census. We have a week to ensure that we all get counted. So please make sure that if you have not completed your census, that you do so at 2020census.gov or call the number 1-844-330-2020. Again, that number is 1-844-330-2020. Thank you so much for joining us, and we will talk to you next week. Thank you.